Is cancer a disease of inflammation?
Well, that's an interesting question, which is, I've just been at the big cancer meeting in Cold Spring Harbor on Long Island in New York last week, where this came up an awful lot of the time. Cancers involve a lot of inflammation, but I think the reason that they do so is that cancers are a hijacked normal regenerative program. So when you injure a tissue, it rebuilds and regenerates. The important thing is it normally starts, and then when it's healed the wound, it stops. And in cancer, the process can't stop because it's driven by errors in your DNA, in the program, that can't turn themselves off. Now, when you regenerate tissue, there is inflammation, because inflammation is how you rebuild tissues, fend off infectious entities, agents, bacteria, whatever, and also remodel the tissue to bring it back to where it was before the injury. So cancers involve a lot of inflammation because they've hijacked a process that involves a lot of inflammation.
Right. Does this mean that there's any need for looking at your diet as far as causing an increase or decrease in inflammation in your body through your diet? Is that even a possible to do?
Well, I think we now know that we're all eating a diet, well, not all, but most of us are eating a diet that's got too much sugar in it, probably too much fat in it, and therefore is associated with all sorts of diseases, metabolic syndromes and diabetes and all sorts of other things. So I think managing your diet is certainly a very good thing. In terms of cancers of the intestine, there's reason now to believe that the more diverse your diet is, the better it is, because your intestine lives in close association with a lot of bacteria, and keeping those bacteria diverse it seems to be very, very good for the health of your intestinal tract. So I would have thought the health benefits in general of keeping relatively slim and eating the right foods are so overwhelming, not just for cancer but also for cardiovascular disease and everything else, that it's just a really good thing to do. And doing exercise, the evidence is that that also can help to suppress the incidence of cancer as well. So keep happy, keep healthy, eat the right things. Yeah. What's difficult about that?
Perfect. So what about being able to change the pH? So there's a lot of talk of alkaline diets and that cancers grow in acidic environments, so therefore...
Absolutely no idea what these people are talking about. There's not a shred of evidence that cancers prefer this or prefer that, low pH or high pH. There's not a shred of evidence that your blood pH is significantly changed in any way. I spent my life as a biochemist, a physiologist and a molecular biologist. I have no idea what these people are talking about.
I would have thought that the body's really programmed to keep your blood pH pretty level.
It is. And you can drink lots and lots of orange juice and you don't go acidic.
Yeah.
Well, that's because you've got brilliant systems for maintaining the right levels of acidity and alkalinity. But again, this notion that cancers like, I can't even remember what it is, they like alkaline?
Acid.
Acid, okay. How does that work when it's basically a disease of broken regulatory mechanisms at the DNA level? It makes no sense whatsoever.